directly see. All right? So you get a lot of subtle changes that you can notice in the eyes, and if they could get a better way of measuring improvement that they could objectively measure, they would be much more excited with that than they would with our subjective feelings, right? So I think that's probably what they're starting to study toward, because if you can show an objective improvement, now you move light years ahead as far as acceptance with the medical community, because it starts to fit into a mechanism that they can understand, whereas symptoms and feelings aren't as reliable to them. They even disregarded all my symptoms of 15 years because I hadn't seen a physician about them.
Hi, I'm heading to Bulgaria next month, and you mentioned you had stopped, I believe it was Sandra, taking ginkgo because it was going to cause problems. What would be the best supplements for me to be taking now ahead of the procedure?
I didn't.
Somebody said something about they had to stop ginkgo.
Betty?
Yeah, I'm sorry, Betty.
I mean, my advice would be for you to consult with your own natural health practitioner. I saw a Chinese physician and a woman who practiced holistic medicine. So it was based on her advice that I stopped all my supplements except for digestive enzymes and probiotics for the week before my treatment.
Okay, I don't have one of those doctors, so if Dr. Code could maybe just tell me if there's anything I really should be avoiding right now.
The longest acting one is aspirin. It's active on the platelet for the life of the platelet, so nearly 2 weeks. So if you're on any aspirin version, stop it 2 weeks ahead of time. The other non-steroidal anti-inflammatory drugs, it's 5 times the half-life, so a week is certainly sufficient. So that would be the ibuprofens and so on. So, those are the big ones, but some of the herbs interact. Ginkgo does. Ginkgo biloba, all right? So if you can't determine it, then you can either see someone in consultation additionally, like myself or whatever, or you can check with your pharmacist of anything you're taking. Many of those are very well studied and understood. Your pharmacist will know because this comes up all the time in their warfarin patients, and there's many, many people on that. So that's the reference point I would go with. Because if it interacts and it's a challenge within the warfarin world, then you better avoid it for that week or two.
I just wanted to know where these clinical trials are coming from. I think it was Bob, the unmarried one, that was talking about clinical trials and how much less expensive it was in Mexico if you were part of the trial. Maybe I'm mistaken, but I'm curious to know where the trials come from. Thank you.
Well, the clinical trial was actually started by Dr. Mogel. He assembled his team, which included the neurologist, radiologist, the MRI technicians, and so on and so forth. He also included, at the end of it, we actually had an interview with a psychologist who was very interested in what happened to us in our perception of having MS to having this treatment and what it has done for us personally. When he did this, assembled the study, all the doctor's staff who were doing it did it free of charge. They didn't charge anything for their time. It was really a very good study. The results were then administered to the Amerimed Hospital, which he was working out of, and then he was able to get the go-ahead there to start undergoing irregular treatments, which started on June the 28th. Does that answer your question, ma'am?
Can somebody maybe talk about what clinical trials are being done, and can anybody be a part of this clinical trial? And I think that's the question that's happening in the room.
Well, I'm sure most of you have heard of clinical trials that are happening. I mean, there's a joint one happening between UBC and University of Saskatchewan. There was one initiated in Stanford, and there's many, many. Typically, before a clinic or a hospital or a university will take on a new procedure for them, they will usually do, you can call it a pilot project, or you can call it a clinical trial. All right? So, and as they're learning to do that particular procedure as a team, usually they will call it a clinical trial, and they will be doing their first set of people at a much reduced cost. All right? Because they are learning with you. All right? Now, it doesn't mean that they don't know what they're doing, but they haven't done it in this series of people, in this series of patterns on the venous side before in this example. Okay? So being part of a clinical trial, it's a long shot to get in on one, all right, relatively speaking. However, with new places starting up, there will probably be more of those in that regard, but it's a matter of luck and where you're standing at the time, and are you willing to take the potential risk associated with it. The more experience they have, the less clinical trials that particular facility will do, unless they're doing a much bigger clinical trial, as they are in Buffalo, for example. They're doing 500, because they're trying to replicate or study Dr. Zamboni's results. All right? So clinical trials come for any number of reasons, but I think in the Amerimed case, they were validating that they could do this reasonably within their institution, so then they could get the wherewithal and the ability to undertake it in that institution, in that set of hospitals.
Wouldn't it be fair to say that most of these trials are closed? They've already got the people that they want to do in these trials, and so if you're not on a trial now, it's probably very difficult to get on one. That would be my estimation.
Well, there's new trials starting up too, Braden. But I know. I run the Facebook page for UBC MS Clinic, and I'm not affiliated with UBC except I'm a patient there. But a lot of people ask, well, how do I become part of UBC's trial? And the answer was, if you're registered with any MS clinic in BC, you are in the pool to be selected. But as you saw, their demographic for that selection was far narrower, and rightly so. They had to choose a particular demographic for their study. And I would say to people, before they announce their demographic, do you want to be part of a clinical trial? As Dr. Code said, there may be additional elements to it. Secondly, if it's a placebo study, you might not know for 4 years whether you got the actual treatment or a sham treatment, in which case that's 4 years where you might at the end of it. Now, if the treatment is worthy, if the other participants who got the real thing benefit, part of your participation is if you do get the placebo, they offer you the treatment at the end of it. However, you may have to, they want to study MS longitudinally, and a lot of doctors are saying the outcome is 4 to 5 years before they will know the outcome of a clinical trial on angioplasty of this sort. So, if you get the chance to go into a clinical trial, if it's a placebo-controlled trial, what they call a double-blind study or something like that, be aware that you have a 50-50 chance of getting into the placebo group, and are you willing to wait the full 4 years to get treatment? Because the researchers don't want you to cut out at 2 years and go, okay, I'm going to go get my treatment in Poland, see ya. They want you to stay in there for the duration. So being part of a clinical trial may mean you get it for free, but there are costs in terms of your risk to that. Okay, who's got the microphone?
Can I just comment on that quickly? Sure. I was part of a study that's still ongoing in Poland. I did pay for it, but it was significantly cheaper than, let's say, the clinic that Betty went to, which was a private clinic. It is more of a longitudinal study, so they're testing the effects of the treatment, the liberation treatment, and testing the results, and they're following up with us. But you have to have the money to go into the study. It's not just, they don't just select people randomly. Yeah. And none of us were blinded. We all knew, we were getting the procedure, so.
Okay, go ahead. If you have the mic, go ahead.